Hi, my name is Tanya, and in this presentation, I will be explaining entropy and holistic negentropy as it relates to the Neuman system model. This is a more recent picture of Betty Neuman. This is a fun video that puts a spin on the Neuman system model and kind of gives you a little background of Betty Neuman. The Neuman system model is a way of identifying stressors in every area of life and dealing with their effects on a client, no matter how simple or complex the situation might be. This is a simplified diagram of the Neuman system model. This will help us understand the effects of entropy and negentropy and where in the system these terms can be applied. Entropy is actually a physics term having to do with the second law of thermodynamics. A thermodynamic quantity representing the unavailability of a system's thermal energy for conversion into mechanical work, often interpreted as the degree of disorder or randomness in a system, lack of order or predictability, gradual decline into disorder, and a process of energy depletion and disorganization moving the system toward illness or possible death. Entropy has to do with the amount and quality of energy available for a system to be functional. An increase in entropy means a decrease in the available energy needed, causing that system to become chaotic or disorganized. So essentially, entropy means energy. Negentropy is a process of energy conservation that increases organization and complexity, moving the system toward stability or a higher degree of wellness. It is characterized by a reduction in entropy and corresponding increase in order. Negentropy is the opposite of entropy, where entropy is an energy depletion causing the body to become more unstable over time. Negentropy is the opposite of that. The system is able to use the energy available to increase the ability to achieve a state of stability or wellness. So negentropy is actually bringing that system back into a place of normalcy or stability. This is a video that is going to try to help understand entropy and negentropy a little bit better. Entropy and the client. So now that we have the definitions of the words, what does that have to do with the Neuman system model and our clients? Because the client is always changing and their interactions with the environment and stressors change, they are constantly either gravitating toward a state of stability and wellness, which is entropy, or illness and chaos, which is entropy. Sorry. If there is not enough energy and the line of defense, the lines of defenses are penetrated by the effects of a stressor, the client becomes ill and thrown into a state of disarray. This is again increased entropy. If the illness is stronger than the line of resistance and is allowed to reach the basic structure of the client, the energy needed to recover might not be available. In this regard, increased entropy can lead to death. This is could be referenced to our example of the elderly patient with sepsis. They have comorbidities that inhibit them from using the energy that they have to get well. Thus, sometimes elderly people that have sepsis, they do die. Knowing what state or phase your client is in can help navigate nurses through the nursing process, assisting the client to either enhance their state of wellness or achieve optimal wellness and system stability. As we can see from this diagram, the closer the effects are to the core, the more energy it's going to take to repair the breach made by the stressor. The flexible line of defense equals the primary phase. This is the prevention stage. This is where entropy starts over time to begin to cause that line to weaken. However, it doesn't take that much energy to repair it. The normal line of defense, that is where secondary prevention interventions take place. This is the treatment of symptoms, putting interventions in place for this. This is leading more and more toward increased entropy, more and more chaos, and your patient becomes more unstable. The line of resistance, this can be considered in the tertiary phase, and this is where we want to get that person into rehab and strengthen those lines of resistance so that they can begin to move into what we're going to talk about, holistic negentropy, and that is the place of stability and wellness. This is where we want to get our patient to. For example, a client is depressed, currently smokes, and is morbidly obese with severe respiratory problems, remains in a constant state of system disorganization. This client experiences frequently worsening episodes of respiratory failure, which is increased entropy, and is not likely to make a full recovery. Over time, the client has less and less energy available to overcome the instability or the system state of disorganization. Holistic negentropy and the client. Negentropy can be considered the reconstitution process of the Neuman system model. Reconstitution is described in the Neuman system model theory as regeneration, reorganization of structure, adjustment of existing structures for the purpose of bringing to normal strength, forming a new organ, restoring to the original or normal form, and adjusting to new circumstances. This is the essence of negentropy, since we want our energy to be used to bring back to an optimal state of wellness. Holistic negentropy and the client. It can also be looked at in the tertiary phase of prevention intervention. The goal of this phase is to maintain wellness, to increase the strength of those lines of resistance and protect the client's reconstitution. Wellness diagnosis and interventions addressing the 5 variables are established to develop a nursing care plan to achieve holistic negentropy. For example, if we look here at this diagram here, we have the flexible lines of defense, the normal line of defense, and line of resistance, surrounded by what we're trying to achieve is health, stability, wellness, balance, and harmony. For example, considering our previous example, to help this client reach holistic negentropy and strengthen the lines of resistance and the lines of defense to achieve optimal stability, and a holistic plan addressing the 5 variables of the physical, mental, social-cultural, developmental, and spiritual variables must be developed. Entropy is the depletion of energy moving a client toward illness or possible death. Negentropy is energy moving the client towards stability and wellness. People are constantly between the two energy states. Thus, to maintain the lines of defense and the lines of resistance, there needs to be prevention and intervention plan. We want our patients to constantly be moving toward negentropy, which is, again, the reconstitution phase, and that is maintaining their best optimal state of wellness. I hope this helps to explain what negentropy and entropy mean. Thanks for listening, and have a good day.